Welcome to More Than Medicine, the podcast from Zeam Health. This show explores how integrated psychiatry, primary care, and aesthetics come together to support the whole person, not just isolated symptoms. Each episode is grounded in clinical insight, real-world care, and the latest research, helping you better understand your health and the options available to you. Whether you're navigating mental health, managing a chronic condition, or thinking about preventive or aesthetic care, this is where medicine connects. Let's get started.
Most people believe that once you start depression treatment, the path is set. You take a medication, go to therapy, and eventually things improve. But in reality, depression care doesn't work like that. It's not a straight line. It's adaptive, responsive, and constantly evolving. Treatment plans change, medications get adjusted, new approaches are introduced, and sometimes progress means stepping back before moving forward again. None of this means failure. It means the system is working as it should, paying attention. Today, we're going to break down the real reasons depression treatment plans change and why that flexibility is actually a sign of good care, not a problem. When treatment isn't working enough, the most common reason for a change in treatment is simple: it's not doing enough. Clinicians aren't just looking for improvement, they're looking for remission, where symptoms are mostly gone, and that's harder to achieve than people realize. The landmark STAR-D study, which followed over 4,000 adults, found that only about 33% of patients reached remission after their first antidepressant trial. That means 2/3 of people needed adjustments right out of the gate. A partial response might look like sleeping better or having slightly more energy, but still struggling to focus, stay motivated, or feel like yourself.
If symptoms don't drop by at least 50% after a full trial, usually 4 to 8 weeks, clinicians take a step back and reassess.
That could mean increasing the dose, switching medications, or adding another treatment entirely. Side effects that change the equation. Sometimes the medication works, but at a cost. Side effects are one of the biggest reasons treatment plans shift, and they're not rare. Research shows that side effects like weight gain and sexual dysfunction affect somewhere between 30% and 70% of people taking common antidepressants. That's a huge range, but even at the low end, it's significant. The American Psychiatric Association emphasizes that side effects matter just as much as symptom improvement. Because if a treatment makes you feel better emotionally but worse physically, or disconnects you from parts of your life, it's not sustainable. This is where adjustments come in. A clinician might lower the dose, switch to a medication with a different profile like bupropion, or explore options that don't rely on daily medication at all. When depression changes shape, depression isn't static, it evolves. Someone might start with classic symptoms, low mood, low energy, and months later develop anxiety, brain fog, or irritability. When that happens, the original treatment plan might no longer fit. Clinical guidance recommends reassessing treatment if there's no adequate response within 6 to 8 weeks. And even when there is improvement, ongoing monitoring is critical because the target keeps moving. A medication that worked for sadness might not touch anxiety. A therapy approach that helped early on might need to shift as deeper patterns emerge. This is why regular check-ins matter. Treatment has to match the version of depression you're experiencing now, not the version you had 6 months ago. Life doesn't pause for treatment. One of the most overlooked factors is life itself. Stressors like grief, job loss, caregiving, or major transitions can hit hard and fast. When they do, even a solid treatment plan can start to feel like it's not enough. But this doesn't usually mean starting over. It means reinforcing the plan. That could look like increasing therapy frequency, adding short-term support, or temporarily adjusting medication. In more advanced care models, like ketamine therapy, clinicians often build in the idea of booster sessions, knowing that life events will inevitably impact stability. Treatment doesn't exist in a vacuum. It has to flex with real life. The role of patient preferences. This is where things get more personal. Treatment isn't just about what works clinically. It's also about what works for you. Some patients want to eventually come off medication. Others want to avoid it altogether. Some are open to exploring newer options like TMS or esketamine, and when those preferences come into the conversation, the plan shifts. This is called shared decision-making, and it changes everything. Instead of treatment being something done to you, it becomes something you're actively shaping. And that shift alone can improve engagement, trust, and outcomes. When treatment resistance emerges, at a certain point, the clinical picture changes. If someone has tried multiple first-line treatments without success, they may be dealing with treatment-resistant depression. And that's not rare. It's a recognized category that requires a different level of care. This is where advanced options come into play. The FDA expanded approval for esketamine nasal spray in 2025, allowing it to be used as a standalone treatment. In clinical trials, about 22.5% of patients receiving esketamine alone achieved remission by week 4, compared with just 7.6% on placebo. That's a meaningful difference. Moving to something like ketamine therapy isn't a last-ditch effort. It's a logical next step when the data shows that traditional approaches haven't been enough. So if your treatment plan has changed, or needs to, it's not a sign that something went wrong. It's a sign that your care is adapting. Depression treatment is not about finding one perfect solution and sticking to it forever. It's about staying responsive to your symptoms, your life, and your goals. At Zeam, that's exactly how we approach it. We don't see changes as setbacks. We see them as part of the process. If your current plan feels stuck while everything else keeps moving, it might be time to rethink it. And when you're ready, we're here to help you build something that evolves with you. In the next episode, we're diving into something more specific: what patients actually notice in the early stages of TMS therapy, what it feels like, what changes first, and what you can realistically expect in those first few weeks. You won't want to miss that one.
Thanks for listening to More Than Medicine. If today's episode sparked questions about your own health or helped you understand your options more clearly, you're not alone. At Zeam Health, we provide integrated psychiatry, primary care, and aesthetic services designed to support your long-term well-being. To learn more or schedule a visit, head to zeamhealth.com. We'll be back soon with another conversation focused on care that goes beyond the surface.